Hello, I'm Teresa Wilson, President of the Vow Foundation, with Eric Bresee, Executive Director of Farnham Family Services, for a spotlight interview as part of the 2020 Oswego County Safe Fair. Hi, Eric.
Hey, good morning, Teresa.
So, Eric, tell us about the history of Farnham Family Services.
Yeah, sure. First, let me just quickly say thank you for having me and for everything that you and the Vow Foundation have been doing in our community. And I'm happy to have a moment to share a little bit about Farnham. So the origins of Farnham actually date back to 1970 when a professor at SUNY Oswego named Carl Davis, he was part of the Psychological and Consulting Unit, it was called at that time, got a small grant for $13,000 to train counselors specifically in the areas of substance use. They didn't call it substance use disorder back then, but drug use, I guess, and helping people that were struggling with, drugs and alcohol. So he had this one-year grant. He trained a bunch of folks. He created a lot of awareness in the community, and that the programming was offered out of Farnham Hall. There was a dormitory on campus that was named Farnham Hall, and there was a small group of really committed community members that came together that after that grant ended, decided to continue on the work in some way, and they formed a nonprofit corporation known as Farnham Youth Development Center back then, and that was kind of the origin of Farnham. Now, it operated as Farnham Youth Development Center in the 70s and in the 80s, and largely was a crisis hotline, and a drop-in center activities emerged. And then the 90s is when we really started to form the basis for what we see today, the outpatient and the prevention programming. We got licensed by the state to actually provide some of that treatment. And then, it just kind of grew and developed from there to kind of where we're at today. We continued to expand the prevention programming. We partnered with school districts to have counselors in schools for prevention counseling. In 2015, we worked with the Prevention Coalition. I know you were a big part of this, to secure funding to kind of launch those efforts. 2017, we opened the county's first opiate treatment program, and kind of like here we are today. So that's a brief snapshot.
That was great. That's a lot. That's a lot. Eric, tell us, what are the different types of addictions treated at Farnham Family Services?
Yeah, so Farnham really specializes in the treatment of substance use disorder and really the full range of substances. What we see primarily in our community is folks that are coming in for use of heroin and other opiates, and then alcohol. Those are kind of our top three substance areas, but we really serve the full range. There's people with cocaine use disorder that come in, marijuana use disorder, and some of the more dangerous and scary drugs and addictions that are being used right now are in the area of synthetics. And, really concerning for us, and we're really working to provide as much help as we can for folks that are, using those drugs. They're very unpredictable, and we see folks coming in just very sick after using these substances. I mean, just a lot of psychosis, a lot of instability, and it's scary. Some of the things that they're doing while they're on these synthetic drugs. So I would say that's kind of the range, but really any substance somebody's struggling with, we can provide support to help.
Great. What are the different types of treatment that you would provide to help people with a substance use disorder?
Yeah, so we have a range of treatment options. Primarily therapy, I think, is our number one treatment modality. We provide comprehensive assessments, individual therapy, and group therapy. We also provide medication for people that might need it to help with their substance use disorder. The opiate treatment program offers all three FDA-approved medications for opiate use disorder. That includes methadone, buprenorphine, and naltrexone. We have peer services, which is relatively new within the last couple of years. We've trained and hired certified recovery peer advocates to support people that are struggling with addiction in our community. This is, from my perspective, one of our most effective services. I think that when you think about kind of change theory, any change you're trying to make, whether it's, you're trying to change your diet, or you'd like to go to the gym more, or you'd like to quit smoking cigarettes, or, you'd like to drink less alcohol, you want to talk to somebody that's been through it, that's done it. You want to see what's worked for them. You want to hear from the source. And this is where certified recovery peer advocates really come into the picture and provide a level of support that has, I think, increased the quality of treatment that we provide. So in addition to therapy, you could have a certified recovery peer advocate. You could be seeing your nurse practitioner or the doctor for your medication. And really our goal is to just individualize the treatment plan to meet people where they're at.
So someone could have one or all of those treatments, actually, right?
Yeah, absolutely. It's sort of like almost like we'd like to have like a menu or a lot of tools in our toolbox. So, because the tricky thing about addiction is it's really different for everybody. There's no one solution, for what folks are dealing with. And so what we found is the best approach is to have, a myriad of different options available. So when someone comes in, we can say to them, hey, look, here's kind of what we have. What do you think would work for you in your situation? Let's put a plan together, and then let's evaluate it as we go. Are you hitting your goals? Are you getting to the point in recovery that you want to? If you're not, let's make some changes. Let's add something in. Let's do something different. And that's the approach that we try to take.
So very individualized plans for everybody?
Yes.
That's great. That's great. Now, Eric, I know Farnham Family Services and the County of Oswego Council on Alcoholism and Addictions, COCO, is merging. Can you tell us a little bit about that?
Yeah, sure. So it's a couple of years ago at this point. I want to say it was beginning of 2019. Penny Green became the executive director over at COCO. And Penny was coming in from another community, had some really great clinical experience, and started looking at the needs of our community, looking at kind of what she felt the needs were. And we started talking about what Farnham was doing. And we came to the realization together that, we might be stronger together, bringing the strengths of both organizations together to better meet the needs of the community. There's things that COCO's always been great at and things that Farnham's always been great at. And so by bringing them together, we kind of thought we would get the best of both organizations. And also it gave us an opportunity to look at reducing some overhead costs, right? Duplicating costs that when you have two different organizations with two separate administrations, you've got repetitive costs. I'll give one example. I mean, rent. They had a building, we had a building. In Oswego, it's not that big of a city, right? And so we saw an opportunity to bring those organizations together, and then that reduces the rent cost. That's money that we're now able to take and reinvest into the development of services in order to better meet the community's needs. And so as we got talking and thinking about it, it just seemed like a no-brainer to bring the organizations together. And so our boards of directors kind of met, talked through everything, decided to move forward, and in the beginning of 2020, COCO became a subsidiary organization of Farnham, and we filed the applications for a full merger right around April, and so we're hoping to have a full merge by the end of the year.
Great. Sounds like it's going very smoothly.
I think so. I mean, from everything I hear, the staff are happy. The clients are happy, and that that's kind of how we gauge our success, right? If folks are still coming in and engaged, and the staff are expressing that they're feeling supported and have job satisfaction. I mean, I think if those things are happening, then we're doing pretty well.
Yep. Yep. Great. Eric, how can a family member help their loved one through their illness?
That's a great question, Teresa. We really, it's sort of in the name, Farnham Family Services. We are big proponents of engaging the family at all level of an individual's treatment, as long as the individual is okay with that. It has to be, their choice. Sometimes we get, mom that wants to come into every session, and we have a young adult that's saying, look, I kind of need this time for myself. And so, we let the individual kind of take the lead, but we do process through them, what the role of family support could be in their recovery. I mean, a family, a lot of times, is a person's most natural support network. And we see, the folks that have the most success have these natural support networks outside of their therapist. They're the ones that are most able to establish, different coping mechanisms that includes, talking to loved ones, or, just to have the support to kind of accomplish their goals. So we offer, to individuals that are coming in, we say, look, let's get a release of information for a loved one that supports you. That way we can have that free communication. That way, when mom or husband or wife calls, we can have open, conversations with them, again, at the patient's direction. We offer therapy for family members. You could come in alone. Say your spouse is struggling with substance use disorder. They're not even in treatment. They're not there yet. They're not ready, but you're struggling. You could come in and receive therapy services from Farnham. You would be eligible. You just come in. It's a little bit of a different assessment process, but similar. We find out what your needs are. We match you up with a counselor, and we get you some support. So I think those are a couple things. We also offer home and community-based services, which are really for the eligible population is folks that have 2 or more kind of major health conditions. So, for instance, somebody that maybe has diabetes and substance use disorder, or that's an example. Those folks, they qualify for these home and community-based services, and we have a family support and training service that's offered that provides education on the disorder. Now, you can get something very similar by coming in and meeting with a therapist individually. It's just a little bit different on the community-based side. So that's kind of an overview, but what I would say is if you're a family member of somebody that's struggling with substance use, give us a call. Let's talk through what we can do to support you, what we can do to support them, and just really encourage that interaction.
Great. So tell us what that person could do that's thinking about seeking treatment. What would their first steps be? Especially if they're afraid of everything.
Yeah, I get that. It can be a big change, and if you don't know what it's going to be like, I mean, I recommend talk to a peer, talk to somebody that's been through it. That's a non-obligatory service. You can call up and say, hey, look, this is Eric. I don't really want to give you any more information about myself, but I would like to talk to a peer, right? And I can get connected with a peer. Now, eventually, we're going to, if you want to continue in services, we're going to want to get some of that information, get your insurance information, all that sort of stuff. But that's a person that you can talk to. It's most likely been through treatment of some sort, or is very knowledgeable about it, or supported a loved one through treatment, that can answer some of your questions and give you an idea of what it's like. You could also call and just ask general questions, of our engagement specialist. When you call, usually an engagement specialist is going to answer the phone. You might have questions about, what would it look like? What's the first thing I do? When do I come in? Currently we have walk-in access hours. The best time to come in is between 10 a.m. and 12 noon, Monday through Thursday. If those times don't work for you, just give us a call. We'll set something else up, or just walk in and we'll figure it out. It's tricky times in the COVID world. So at this point, I say, always best to call first just to know that, someone's definitely going to be there and the best time to come in. But definitely 10 to 12, Monday through Thursday. You can come in, get an assessment, and we try to get people admitted as quickly as possible if that's what they need, and also connected to medication as quickly as possible if that's something that they need.
So with the COVID, you are open.
We are.
How have things changed? What's different?
Well, we're doing a lot of telehealth, right? So a lot of, just like you and I right now, right? A lot of therapy over these screens. And, I would say, I'm a therapist, right? I would say you're never gonna have the same experience over a screen that you're able to have in person. However, it sure is a pretty good substitute when there's risk for, going in for like a disease such as COVID-19, or if you're having transportation problems. I mean, in our community, one of the biggest barriers that folks have to getting to treatment is transportation. And, this, as long as they have connectivity, right? So that's the battle we're fighting with with telehealth, is we have some really rural communities where there's not good connection. Currently, we're also doing telephone, right? So maybe you can't get on a screen, but the state has allowed us to do telephone counseling because of the crisis. And so just a phone call, right? Maybe you just need someone to chat with, you need a little additional support. So COVID really forced us to get that telehealth platform up and off the ground quickly. We've realized in doing that it provides a lot of benefit. Currently, what we're doing is we're kind of taking it person by person. We're talking to individuals about what their needs are. We're looking at what their progress is, how they're doing. There's the other thing about COVID is it's created a lot of stress, for folks. There's a lot of fear. There's a lot of anxiety. There's a lot of depression. There's a lot of folks that lost their jobs, that were, already had some family strife that were sort of just thrown in to their house for 2 months, with that family, that creates kind of a boilerplate environment for, dysfunction. And so, our community needs a lot of support right now. So, we have the telehealth available. We're trying to decide, all right, for folks that's not working out for, let's bring back some in-person services, right? But let's do it safely. Let's follow all the right COVID protocols, and just, we're kind of assessing the risk. What's a greater risk? The risk of COVID exposure or the risk of somebody's substance use disorder? And that's an equation that we got to do with a lot of folks. And we're just trying to meet people where they're at, and also, of course, protect our staff in the process.
Is there anything else that we've missed or you'd like to tell the community about?
Just that, we're here to help. I hope that people know that. I thank you for asking that if we're operational. We are. That shouldn't be a given in these times. And people just got to call to get connected. I just want to encourage family members and people that are struggling with addiction. I want to encourage you to get help. There is hope. These things are able to be overcome. I see people every day that are getting their lives back together, getting their kids, stabilizing their employment, achieving their goals, getting their health to a point where they feel good, every day without any substances. And that is just providing folks with a sense of freedom, and giving them that freedom back, is why we do this. It's why we work, so hard every day to make these services available. So I just want to say, give us a call. Even if you failed before, it doesn't matter. Keep trying. Every day is a new day. There is hope every day. And so, reach out and we'll do everything we can to help.
Thanks, Eric. Now, as a nonprofit, how can people in the community help you, your organization?
Well, we certainly always take donations, Teresa. Thanks for asking. As in full disclosure, as one of my board members, thank you for bringing that up. I think any financial contributions, but even bigger than that, help us fight the stigma.
Ooh.
Help us, pull the blanket of shame away from this medical condition. All right. Substance use disorder is a real medical condition, and people shouldn't feel ashamed because of their addiction, right? They should feel compelled to get help like anything else. If you broke your arm, you wouldn't feel ashamed to go into your doctor to get that taken care of. If you're having diabetes, you wouldn't feel ashamed, hopefully don't feel ashamed, about getting your insulin and taking your insulin every day to make sure that you're stable. We need to get substance use disorder with the same level of thought that these other medical conditions are in, and that it's not a moral failure, that it's something people need help with, and that they shouldn't feel ashamed to come and get help. And so that's probably the number one thing we could use help with, is fighting the stigma.
Great. Great. Well, thank you so much, Eric, for today's interview.
Yeah, thank you for the opportunity. I appreciate it.
Yep. And hopefully we can help the community out.
All right, Teresa.
Thank you.
Take care.